Hello world, and welcome to America. What you doing? With your host, Amira McKee. Today's show is brought to you by Vaseline. Don't be ashy. Our topic for today is racial and ethnic medical inequity. Now, this is a discriminatory practice where minority races and ethnicities are not treated with equality in the medical field. And this is unacceptable, especially dealing with things that impact your life and your health. Outside solutions to this issue include don't ignore race and ethnicity, eliminate biases, and quite frankly, I agree. Reducing racial health care disparities, a social psychological analysis provides three solutions: a physician-focused solution, a patient-focused solution, and a system-focused solution. The physician-focused solution is about learning about health disparities in different races and ethnicities. The patient-focused solution is about the patient remaining calm and not playing into their individual stereotypes. The system-focused solution is about reducing unnecessary variability. These, quite frankly, aren't working. What is the motivation for physicians to learn about other health disparities? How is the patient supposed to remain calm when there's something wrong with their health? The system-focused solution takes away the individuality of the patient, which is sometimes crucial in identifying the root cause. That's why I propose solutions that are based in educating our physicians and making sure there are consequences for those who refuse to educate themselves. This includes diversifying teachings, mandatory professional bias, and investigating medical personnel in regards to their license. First, diversifying teachings. During medical school, there should be a variety of skin colors, races, and ethnicities that are taught. There should also be an emphasis on prevalent diseases across races, as the percentage of how prevalent these diseases vary throughout race and ethnicity. There's also room in medical school to debunk myths, such as the myth that Black people have thicker skin and don't feel pain, which originates in slavery and is still very prevalent in many second-year residents today, according to a 2012 study. There should also be an opportunity to compare and contrast presentational differences between lighter and darker skins. For example, eczema is a skin condition that on lighter skin results in a red, patchy blob that is irritative. But on darker skin, this blob is white. How would you know the difference if you hadn't studied it in middle school, even though it's the same disease? Next, mandatory professional bias training. This should be a subset of residency and professional training. Mandatory bias training should be a requirement of residency, such as the test and the many outreach programs in which you communicate with different hospitals. In addition to that, after residencies, to practicing physicians, there should be a periodical bias training. With this comes proof of attendance, and no attendance has consequences in which they would not be allowed to practice. Lastly, investigate medical personnel upon complaints. Way too many professionals have received complaints about their work, and nothing was done until the death toll was dramatically high. So, as a form of outpatient paperwork, which everyone has to deal with, there should be a way for patients and the family members of patients to make an official complaint with the HR department. There should also be a trigger number of complaints per physician. Once you reach this number of complaints, then the physician's license would automatically be up for review. And this is a valid way to investigate medical license, as it falls under the categories of patient abuse and unethical behaviors and malpractice. In addition to this, the government legislation should be approved to where patients are allowed to look into the backgrounds of their doctors, the medical backgrounds. Don't freak out. This is because there have been many instances where doctors have had their license taken away and then crossed lines to practice elsewhere. And this is quite frankly unacceptable. Racial and ethnic medical inequity is crazy, and it's affecting lives every day. Black mothers have a 4 times more likely mortality rate than white mothers. Black infants have a 3 times mortality rate than white infants. Even today, amidst a global pandemic, in terms of COVID-19, Black, Hispanic, and Latina patients in America have a twice as likely chance of dying from COVID in a hospital as opposed to their Asian and white counterparts. And this is crazy, especially as you see the disproportionality in terms that these Black, Latina, and Hispanic patients attend hospital for COVID-related symptoms, a third of that of their white and Asian counterparts. People are dying from this lack of inequity in terms of race and ethnicity, and it's time for it to be fixed. Please join us next time on America, What You Doing, where we talk about the racial and ethnic inequity in the education system. Thank you so much.